Hi, I'm Dr. Jessica Christie, and today I wanted to talk to you about the connection between cancer and sugar intake. We used to believe that cancer was entirely determined through our genetics. But back in 2003, when scientists finished the Human Genome Project, we were actually able to determine that only about 5% of cancers are coming from a genetic cause. This means that the rest of cancer has to do with our epigenetics, which is a term that refers to how our environment affects whether genes become turned on or off. One of the most important factors in our environment comes from our diet. In the early 1900s, Americans on average would eat about 5 pounds of sugar in an entire year. The most current research, however, is estimating that most Americans are eating between 2 to 3 pounds of sugar per week. This is way more than we used to be eating. We get cancer when our cells have a mutation, and once cells mutate, they develop a different metabolism and different function. This shift in metabolism requires an increase in the receptors found on the outer part of our cells, and these receptors are influenced by sugar. These receptors also influence a factor called insulin-like growth factor, which plays a major role in cell growth and also inhibits cell death, which is actually the opposite of what we want to do with cancer cells. So, what can we do with this information? In naturopathic medicine, we view everyone in a holistic manner and on an individualized basis. So, while I would never give the exact same diet to every patient, there are some key elements that are appropriate for every patient. The main distinction here is going back to a whole foods diet. That means avoiding anything processed or refined. As far as the specifics, you're going to want to speak with your naturopathic doctor to figure out which specific foods are going to benefit you and your overall health, and which foods you should specifically avoid. I hope you found this information valuable. Thank you all for listening.